Hello everyone. Welcome to Apollo Cradle session on how to manage PCOD in pandemic. We would like to welcome Dr. Ruchi Tandon, who is our in-house consultant, obstetrics and gynecology. She holds a degree in MBBS, MS, FICOG, FICMCH, FOGSI, Fellow Art from Mumbai. She has over 14 years of experience in this discipline. We welcome you, ma'am. Thank you for joining us today and letting our audience know more about PCOD and how to tackle it.
Thank you for the lovely words. I would like to start my topic about PCOD and its impact in COVID times. Now, COVID-19 pandemic has impacted the global world in a huge way, and everyone is facing this challenging situation with a sense of fear and anxiety. These challenges have a huge effect on the overall wellness and thinking of the population, especially the female population. It is a well known fact that women in general tend to ignore their health needs due to the overwhelming responsibilities and tasks and commitments which are expected from them. It is a proven fact that stress levels majorly affects the female hormones, which in turn can be strongly associated with derangements in the menstrual cycle, causing predisposition to other diseases, hence changing these psychosocial stresses into long-term health conditions. PCOD is one of the most common endocrinological disorders seen in the younger age group. This condition is associated with multiple follicles developing in the ovaries and thus causing a spectrum of menstrual abnormalities and irregularities like deranged menses, absence of menses also. The changes in the hormonal levels predispose the women to other symptoms like acne, male pattern of hair growth, hair loss, dysmenorrhea, bloating, etc. Moreover, the risk of severe COVID is also linked with certain factors such as hyperinflammation, low vitamin D levels, and hyperandrogenism, that is the excess male hormones, all of which have direct association with PCOD. PCOS or polycystic ovarian syndrome is also associated with other health conditions such as type 2 diabetes, obesity, hypertension, and hypothyroidism, which may significantly increase the risk of developing complications of COVID-19 itself. So, as you see, it's a vicious cycle. PCOS is a complex condition involving multiple body systems, and hence it can lead to a cycle of stress, depression, and anxiety, which can again have very adverse outcomes in these cases. It is important for women to be in touch with their treating doctor or the gynecologist and avail medical advice in case of any of the above symptoms. Here are some quick tips that I feel you all should keep in mind to keep your disease in check. The most important thing in PCOS is maintaining a healthy lifestyle. Now, maintaining a healthy lifestyle by eating a balanced diet and avoiding excessive junk food is extremely important in illness like obesity and associated comorbidities, and especially in managing PCOD. The diet should comprise of sugar-restricted, low carbohydrate, and high protein foods with plenty of fresh fruits and vegetables. There are numerous online fitness opportunities and regimes that can be followed in order to stay fit. Taking time out for a physical fitness schedule enables proper weight management as well as emotional well-being. Smoking and alcohol intake should not be used even as stress busters. Online and teleconsultation follow-ups should be encouraged in PCOD. Things will only get better if we stay informed, if we stay prepared, if we stay calm, and if we stay safe. Having a sleeping disorder can harm your immune system. A healthy body needs rest in a disciplined manner and routine intervals. You must aim to get a good 7 to 8 hours of sleep at night as a healthy PCOS solution. Meditation or deep breathing exercises can help reduce the stress levels in PCOD. In a study published in May 2021, researchers at University of Birmingham found that women with PCOS are at significantly increased risk of contracting COVID 19 as compared to women without PCOD. This makes it more important for women suffering with PCOS to take care of their stress levels. I think to begin with, this much information about how to handle PCOS in COVID pandemic is just the beginning. I would like to encourage any questions from your end.
Um, Hi, ma'am. So there are two questions that are there. So I was COVID-19 positive, post recovering PCOD, post recovering COVID-19, PCOD was detected, and since then I have started bloating. What should I do?
Thank you. This is a very important question. Like I already said, the symptoms of PCOS have to be kept in check, and you should show to your gynecologist even through a teleconsultation. They will get a baseline series of investigations to see whether your hormones are within range or have they exaggerated because of the COVID disease itself. And treatment, as I told, comprises of two things. One is lifestyle change, and the second is medications. Most of these medications take care of our symptoms of PCOS, but the overall health of PCOS is kept in check by our lifestyle.
Right. And the other question says that does drinking lots of water while having PCOD lead to bloating?
No, I don't think so. The bloating that occurs in PCOS is because of the hormonal imbalance. There is an increase in the LH hormone as compared to the FSH. And because of that, the secretory phase can be exacerbated. It's not because of water per se, rather, drinking water is encouragement of a healthy lifestyle. The bloating itself can be controlled by taking care of the male hormones, that is, keeping the androgens in check. Of course, you need to discuss your symptoms with your gynecologist.
Thank you, doctor. So you can proceed further, and then whenever the question comes in, we'll
Yes, of course.
collect.
Are there any more questions?
Not yet, doctor. You can proceed, and then we'll come back to the questions again.
I've been practicing obs and gynae for the last 14 years in Apollo group of hospitals, and I have noticed a surge in the number of PCOD patients, especially during the pandemic. I think it's very unfortunate because women are overwhelmed by the burdens of their personal responsibilities, as well as working women who are unable to give that much amount of time and devotion that they were initially given. So I think it's very important to maintain your lifestyle in check, to continue exercising, to have a balanced diet, and keep in touch with your treating gynecologist.
So, doctor, the other question that has come in that, like you said, PCOD, PCOS can be connected to stress and other factors. So, there's a similar question: can mental health like depression be a cause of PCOD or PCOS? Can it lead to
See, PCOD people are prone to mental, illnesses like depression also, because, like I said, there is a hormonal imbalance. All the more, they should maintain a healthy lifestyle. And yes, there have been patients where they might need, psychiatric help also. And most of these symptoms they resolve once the hormonal milieu is maintained, or rather, once we maintain the hormones within check.
Right. Next question says that how often should we get a full body checkup done in order to see that we are in the right condition?
See, like I said, PCOS is also associated with other diseases like type 2, diabetes and hypertension. So if you have PCOS, which is a syndrome, the difference between PCOD and PCOS is a syndrome when it encompasses even other disorders. So if you have PCOS, definitely you should go in for a yearly checkup which encompasses all your not just your hormones but even your other parameters, and taking care of your sugar levels and blood pressure, and that should be at least once a year. And if you have PCOD and if it is within check, then it's all right. It depends on your gynecologist, what she prescribes you. If you're taking your medicines regularly, if you don't have any increase in symptoms, that is also all right to get it once a year. Or if you feel that your treatment is not working, at least twice a year, you should get a complete checkup.
Thank you, doctor. The next question says that how do we control or avoid bloating with PCOS?
Smriti ma'am, like I already said, the bloating is due to the change in the hormonal milieu. So there are certain medicines which will be prescribed to you by your gynecologist, which reduce the androgen or the male hormone production. And once these hormonal milieu is maintained with the help of medications, this bloating is taken care of. And you should have a balanced diet. You should not have food which predispose you to gaseous distension. So simple meals would be more advisable for patients with PCOD.
Okay. Moving on to the next question. Is it true that if we lose weight, we can get rid of PCOS?
Now, this is a very important and a very burning question. Like I have seen in a lot of social media discussions, this is often discussed, and they say that we can treat you or cure you of PCOS by just helping you lose weight. Now, losing weight will help in treating your symptoms, definitely. But PCOS is a lifelong predisposition. So you have to keep yourself healthy and in check. And of course, losing weight is one of the ways of treating PCOS itself. But it is not the definitive cure of PCOS because it can manifest in many ways, right from fertility to your menstrual disorders to skin problems. But of course, changing your lifestyle will encourage in the treatment.
Thank you, doctor. I think the another question that we have also is a lot asked by our audience that can we not get pregnant if we have PCOS?
See, usually, if a patient comes to me with infertility and I incidentally diagnose that she has PCOS, with treatment she has a good chance of conceiving. Her infertility can be reversed once she has been treated. And the mainstay of treatment in such patients is ovulation induction, because in PCOD patients, there's a disorder in ovulation. Most of these patients are anovulatory, and they are the patients who benefit a lot from ovulation induction drugs. So if you have infertility and have been diagnosed PCOS, I would rather put it as a good news because PCOD is very easily treated.
Okay. So does PCOD only affect overweight people?
No, there is a spectrum of people. I have a lot of patients whose weight is within check. Rather, they are the thin, the lean category of PCOD, and they are the ones who are probably genetically predisposed to PCOD. And with treatment, they also respond very well.
Okay. Do consumption of contraceptive pills lead to PCOD?
No, on the contrary, contraception pills take care of your ovulation, and they are one of the mainstay of treatment of PCOD, particularly in the adolescent population. So, this is a myth that contraception causes PCOD. Rather, contraception pills, they take care of PCOD. It's one of the line of treatment.
Okay. So if I have irregular periods, do I have PCOS?
Not necessarily. If you have irregular periods, it can be because of various reasons. But yes, PCOD in a young adult population has to be ruled out. It can be by a clinical symptomatology or with the help of an ultrasound or with biochemical markers.
Okay.
Smriti ma'am, I have to take your leave because I have a case in the OT.
Okay,
It
okay.
was,
Sure,
yes.
doctor. Thank you so much for
So
your
it
time.
was a pleasure doing this session with you. And PCOS is it's a topic that is very close to my heart.
Right.
since I feel that the youth is the future of our country. And my advice to all the younger population is to take care of your health. And if you have PCOD, you should be in regular touch with your gynecologist. Thank you so much.
Thank you so much, Doctor. Thank you for joining us. Hope we get to learn more about PCOS from you and you have, a little more time for the audience. And we'll definitely collect a few questions that come in from the youngsters, especially, and get it sorted from you. Thank you for your time. Hope to see you all soon in our session today at 1 o'clock. Till then, see you all. Thank you.